When somebody's on chemotherapy, Dr. Shah, what is the role of nutrition there? Does that help to manage side effects? Does that help to increase the efficacy of the chemotherapy itself?
Great question, which is what I think we need more clinical trials in this space. As you know, doing clinical trials in nutrition are much harder as they are not, they require grant funding. They need to be planned. It's not coming from a pharma company, so it's investigator-initiated studies. And I think that we need more of those kind of studies showing that to help build the evidence and help the oncologists and patients feel more like they want to make these changes because they're already seeing that this could benefit them. Though I do think that there are some studies like that. So in acute lymphoblastic leukemia, high risk, there's a study published in Blood Advances in 2021 showing that for 1 month, patients were asked to eat slight calorie restriction, but it was more also looking at eating a healthier food plate based on the USDA MyPlate guidelines, and then increasing also physical activity. And what they showed in that study was that the patients who those that followed it had an increase in MRD negativity rates or complete remission rates compared to a historical control. Now, this was a single arm study, not a randomized. So we'd like to see a randomized study. And that study was called the IDEAL study, where they looked at and showed this historical control. And now there is a randomized study going on called the IDEAL 2 trial. So that's one example, but there are many more like this where I think that quality of life, side effects, being able to tolerate chemotherapy better are all things that could be improved with nutrition.